to assess the level of consciousness in children. So these children is of meningoencephalitis. The children has come in our emergency with fever and episode of seizure, that is convulsion. So how to assess the level of consciousness now? So level of consciousness, there is one scale called Glasgow Coma scale. So on the basis of this scale, we assess the level of consciousness. There are three components: eye opening, verbal response, and motor response. So eye opening 4, 3, 2, 1. Verbal response 5, 4, 3, 2, 1. Motor response 6, 5, 4, 3, 2, 1. So one by one we will assess. So total is 15. If the score is 15, it is completely normal. If the score is between 13 to 15, it is mildly depressed, and if it is between 9 to 12, it is moderately depressed, and 8 and below, it is severely depressed. So if it is 8 and below, the child may require invasive mechanical ventilation. Now one by one, how to assess it? Starts from eye opening. If the child is opening his or her eyes spontaneously, the score is 4. If you will ask the child to open the eye, then it opens the eye, then score is 3. If eye opening is after some painful stimuli, like we will give some pain and then the child will open eye, then it is 2. And even if painful stimuli, there is no opening of the eye, then it is 1. So score 4, 3, 2, 1. This is of eye opening. 4 scores. Now come to the verbal response. Verbal response assess start from 5. If the child is well oriented to time, place and person, score is 5. If the how will assess? Ask the child where you are, in the hospital or at home, what is the time, it is day or night, who is standing surrounding you. So this is orientation to time, place and person. If the child answers well oriented, so score is 5. Then score 4, when the child is confused, he is not answering properly, then score is 4. Then score 3, the child is using inappropriate words. Like you will ask the child, what is this? He will say this is chair instead of bed. So inappropriate words. Then if the child sound is incomprehensible, means the child is saying something but we are not able to understand what the child is saying, then it is a score 2. And none, no response, score 1. So this is verbal response. Eye response, that is eye opening, verbal response, eye up to a score 4, verbal 5. Now come to motor response. Motor response starts with a score 5 if the child obeys command. Command means when I asked the child to show the tongue, he was showing the tongue, so the child is following command, then it is score 5. Then local 4 is score 4 is local obeys command is score 6. Motor response starts from score 6. So obeys command score 6. Localizes pain. When we will give some pain and the child will bring his or her hand at the site of pain, it means he is localizing pain. It means it is a score 5. If the child is not able to localize the pain, we give the pain, but child will not bring his or her hand at the site of pain, but just withdraw the limbs. So withdraw to the pain. Then it is a score 4. Then a score 3. There is abnormal flexion, like the child is flexed. Always he is keeping the hands or legs in a flexed abnormal position. It is score 3. And abnormal extension, score 2, means there is extension. Abnormally the limbs are extended, upper limb and lower limbs extended. So it is score 2. And no, there is nothing, no response, it is score 1. So 6, 5, 4, 3, 2, 1. This is motor response. So motor response 6, verbal response 5, eye response 4. Total score is 15. That is all regarding assessment of level of consciousness by Glasgow comma scale. Thank you very much.